My friend Joseph says that he cures all diseases with chamomile. From head to toe, all kinds of problems, all fixed with chamomile. And if, by chance, he gets something serious, for instance cancer, and chamomile cannot help, then he gets a plant from India, which helps even in such cases. In short, he cures everything with plants. Then I have another friend, Urban. He does the opposite. He says that if he gets sick, he will not deal with teas. He uses only real medicines for the disease. Well, like Joseph and Urban, there are two stereotypes among people. One says that medicinal plants cure all illnesses, that a flower grows for each disease, that nature is always right, and that synthetic drugs are just a deception. The other, the opposite stereotype, says that medicinal plants are obsolete, that they're alternative, that they're unscientific, something that witch doctors and old women use to cheat people. This example about witch doctors and old women, this is a quote from a book of Dr. Fran William Lippick from the beginning of the 19th century. He was a doctor in Ljubljana and had such opinions on medicinal plants, but not about all of them. He only held such a poor opinion of plants that people used themselves. While he, as a representative of official medicine at the start of the 19th century, also had nothing to use but medicinal plants. And of these plants, which he used in his own way according to medical standards of the time, he had the exact opposite opinion, more in line with that first, optimistic stereotype about plants. He wrote in this same book that in the vicinity of Ljubljana there were plants that could treat all diseases of the people of Ljubljana, and that this is a general rule in nature, that in every place the plants that people need will grow. How these two stereotypes affect people's choice of medicines is illustrated in a modern example, statins, how people decide on statins. Statins are medicines for lowering cholesterol in blood. And as with all medicines, both herbal and synthetic, statins also have some undesirable side effects, such as causing muscle pain. These side effects disturb people so much precisely because they associate them with the medication that they consider to be synthetic, artificial. They worry them so much that they do not want to use the medication. Even if found necessary and prescribed by a doctor, patients reject them. And they look for something else to help with their high cholesterol to avoid using statins. And so they find a food supplement with fermented red rice. And since this is something natural, they do not even wonder if this food supplement may also have undesirable side effects. And even if they hear about them, they would not mind, because it's natural. And they do get them as this fermented red rice has the same undesirable effects as it contains exactly the same substances. Within it are statins, produced by yeast cells. And they are present in this food supplement in an untreated, inaccurately measured form, in the form of a product without proven quality. While in medicinal products, it is precisely measured and has proven quality. Nevertheless, people select the other just because it is natural. I, as a scientist of the 21st century, cannot agree with such stereotypes to lump all medicinal plants together. Whether we lump them into an optimistic group and say that they are all very effective, or a pessimistic one and say that they are all ineffective. Let's take a look at some specific examples. Let's take a walk in nature and look at some plants. What is our knowledge about them? How can we effectively use them, and what are their limitations? Let's take a walk through an arid meadow, and already when we step on the thyme, we detect its smell. You can close your eyes and imagine the smell of thyme. If you have never walked through wild thyme, imagine the smell of culinary thyme as they are the same herb. These aromatic substances that the thyme contains are in the plant not in order for us to smell them, but since they are useful for the plant. For example, they prevent caterpillars from chewing their leaves. And these essential oils kill bacteria and fungi that attack the plant. In short, the plant itself benefits from these substances. With the right knowledge, we can learn that these essential oils from thyme can be used to relieve cough. Not because nature is so generous, but because we know that these substances have this effect. Well, let's continue our walk so we get to a beautiful yellow-flowered plant, St. John's wort. Its Latin name is Hypericum perforatum, and it is a very useful plant for the treatment of depression. At the same time, it is one of the most investigated medicinal plants. We know much about its chemistry, what it contains, and about its effects, which were studied in laboratory conditions to know the several mechanisms through which it works. For example, One mechanism of action of St. John's wort is to increase the concentration of serotonin in the brain synapses. Serotonin, that's what people call the hormone of happiness. And the most important part for users is the research on patients. What have they shown? The so-called clinical studies that give an objective answer to a question, does a certain medicine, synthetic or herbal, really work? Well, in the case of the St. John's wort, many studies have been carried out, several dozens. One, a study in Munich from 2015, summarized all of these findings and found that St. John's wort was at least as effective as the most effective synthetic antidepressant medicines in most types of depression. Some patients still have need of synthetic drugs, but for most types of depression, St. John's wort is the most effective choice. So, some advice for my friend Urban, who appreciates only synthetic medicines. In this case, without reason, he limits his selection and excludes St. John's wort just because it is a plant. In fact, it is the most effective choice. Since we know much about St. John's wort, because it is so well studied, we also know some of the safety concerns associated with it. In St. John's wort, the problem may be the interaction with other medicines that the patient is using concurrently. If they use other drugs at the same time, the concentration of these other drugs in the blood may be reduced. This reduces its effects and can be dangerous in some cases. So for the sake of safety, St. John's wort must be used with all the knowledge we have available so that its use is safe and efficient. Now let's continue the walk from the meadow to the forest, and we arrive at my favorite medicinal plant, white fir. Why am I so glad to see it? Because with my colleagues at the Faculty of Pharmacy, we have intensively studied it for the past several years. We also started research at the chemical level. What does it contain? We found that it contains antioxidative acting polyphenol. These are very special polyphenol with a so-called lignin structure. Then we found where they are in the highest concentrations. Most of these polyphenol are present in certain parts of branches and wood knots. How do we get them from the branch? How do we extract them? This can be accomplished simply by extraction with hot water. It is not necessary to use any organic solvents. And it is also not necessary to cut down fir trees specifically for extraction. It is sufficient and effective to use branches from freshly felled fir trees that are cut down by the wood industry. And also in fir trees, more than chemistry, you're probably interested in how it works. We are also performing these investigations. We have already investigated a lot in many areas. We have made the most progress in diabetes research. We found that the fir lowers blood sugar in diabetic patients, which increases after the meal. The extent of increase is reduced with fir extract. We have even found what mechanism is responsible for this effect, the inhibition of the two enzymes involved in the process of sugar transition into the blood. In diabetic patients, however, elevated fasting sugar may also be a problem, that is, before the first meal in the morning. This can also be decreased with fir. This was also shown in our research, but the mechanism must be different. The inhibition of digestive enzymes does not work here, so the mechanism must be different and still unknown to us. So there's some more research ahead of us here. Well then, in addition to diabetes, the effects on skin have also been shown. Excellent effects on the structure, functionality, and even the appearance of the skin. Furthermore, in athletes, it can accelerate regeneration after intensive training. And in cardiovascular diseases, for example, we found two things. One is that it reduces atherosclerosis, the formation of atherosclerotic lesions in the vascular wall. And fir also protects the heart muscle from damage caused by a heart attack. And there are also a few other studies in progress. The fir is therefore an example of a medicinal plant where research is still being intensively carried out, but many interesting things have already been scientifically explored or confirmed. Let's walk back from the forest to the meadow and observe a medicinal plant that is the symbol of all medicinal plants, chamomile. My friend Joseph, a fan of medicinal plants, likes this plant the most. Like him, other people also use it to treat various diseases. Through the centuries, it has been used for psychological stress, stomach problems, skin issues, troubles with mucous membranes, and so on. And many of these effects have also been studied in more or less definitive research in the laboratory and also clinical trials. But none of these studies are definitive enough, at least according to the European Medicines Agency, to say that at least one of chamomile's effects is scientifically justified. In short, there is not enough research. So my friend Urban might be right here, that some medicinal plants still do not have their effects confirmed. Nevertheless, Joseph can continue to use it. And I would also advise Urban to try it for his stomach problems, using it and not minding what the research has shown if it helps him. Let's continue the walk to the last plant that I will present to you, the willow. It grows by the water, and its bark has been used for centuries to relieve pain, such as rheumatic aches, and to reduce elevated body temperature, for example in flus and colds. These effects and their mechanisms were also investigated and confirmed in clinical studies. So strongly confirmed, without bias, that even according to the European Medicines Agency, we can say that the willow's effects are scientifically justified. But this doesn't mean that there is nothing better on the side of synthetic drugs. In fact, there is. Many synthetic drugs have been developed over the last 100 years, many on the basis of findings obtained by studying willow. For example, aspirin was developed in this way. And these medicines, which were then derived and further optimized, are even better and safer. So even though willow has scientifically proven effects, why not use synthetic drugs that work even better in this case? So here is my advice to my friend Joseph, to broaden his horizons and not only use medicinal plants, as in some cases synthetic drugs are more effective. I'll make two conclusions, one for the medical doctors. Doctors are often pessimistic about medicinal plants, namely, they believe in the stereotype of the inferiority of medicinal plants. I would advise them to acknowledge that the stereotypes exist among people, and when they have two medicines available, one herbal and one synthetic that are approximately equally effective, they should take into account that patients have stereotypes and select the medicine according to the patient's beliefs, and not according to their own prejudices. And a conclusion for all of us. Let us break these stereotypes and choose the most effective medicine, regardless of whether it is synthetic or herbal. And to do this, pharmacists can help to inform us. Thank you.